Central venous access devices, CVADs, are a game changer in patient care, especially for those needing frequent or long-term IV access. These catheters go into large veins like the subclavian or jugular, making it easier to administer medications, fluids, blood products, and even nutrition without constantly poking the patient with new IVs. There are three main types: centrally inserted catheters, peripherally inserted central catheters, PICCs, and implanted ports. Each serves a different purpose depending on how long the patient needs vascular access and what kind of therapy they're receiving. One of the biggest reasons to use a CVAD is to avoid the limitations of regular IVs. If a patient needs IV antibiotics for 6 weeks, a standard IV won't last. It will infiltrate, collapse, or need frequent replacement. CVADs solve that problem by staying in place for weeks or months while providing a direct line into the bloodstream. They also allow safe administration of vesican drugs, like chemotherapy, that would destroy smaller veins. Some CVADs are even rated for contrast injections, which is crucial for patients undergoing frequent imaging studies. Like anything in medicine, CVADs come with pros and cons. The advantages are huge: immediate access, fewer needle sticks, and a lower risk of extravasation, which happens when medication leaks into surrounding tissue. But they're not without risks. Infection is a big one since the catheter is a direct line to the bloodstream. Insertion is also an invasive procedure, so there's always a chance of complications like bleeding or accidental lung puncture. Centrally inserted catheters are placed directly into a large chest or neck vein, with the tip sitting in the superior vena cava. These can be non-tunneled, used for short-term therapy, or tunneled, designed for long-term use with a cuff under the skin to help reduce infection risk. Some of the well-known tunneled catheters include Hickman, Broviac, and Groshong. PICCs, on the other hand, are inserted into a vein in the arm but still extend to the superior vena cava. They're a solid choice for patients who need IV therapy for 1 to 6 months. The downside? The arm with the PICC can't be used for blood draws or blood pressure measurements. PCs have a lower infection rate than other central lines and are less expensive, but they come with their own risks, like deep vein thrombosis and phlebitis. A midline catheter is a sort of in-between option. It's like a shorter PICC, about 3 to 8 inches long, and doesn't reach the superior vena cava. It's technically a peripheral line, but can stay in place for up to 4 weeks, making it useful for patients who need extended IV therapy, but don't quite require a central line. Then there's the implanted infusion port, which is completely under the skin. The catheter connects to a small port, usually placed on the chest, that can be accessed with a special non-coring needle. It's a great choice for long-term therapy, like chemotherapy, since it's low maintenance when not in use. Some ports, called power ports, can also handle contrast injections for imaging studies. CVADs are incredibly useful, but they come with complications. Catheter occlusions can happen if the line gets kinked, a clot forms, or medication residue builds up inside. Embolisms are another risk, whether from air, a clot breaking loose, or even a piece of the catheter itself. Pneumothorax is always a possibility during insertion, especially with subclavian lines, since there's a chance of accidentally puncturing the lung. Catheters can also migrate from their original position, messing up drug delivery and requiring repositioning. Managing a CVAD properly is crucial to prevent infections and keep it functioning. Nurses need to inspect the site regularly, looking for redness, swelling, or pain. Dressings have to be changed according to hospital policy, usually with a transparent, semi-permeable film. And chlorhexidine is the preferred antiseptic. Flushing the catheter is key to preventing occlusions, but it has to be done correctly, with normal saline, using a 10 ml syringe or larger, and applying the push-pause technique to create turbulence inside the lumen. Injection caps also need to be changed, and patients should turn their head to the opposite side while holding their breath or performing a Valsalva maneuver to prevent air embolisms. At the end of the day, CVADs are an essential tool for long-term IV therapy, but they require careful management. Whether it's a PICC for a few weeks of antibiotics, a tunneled catheter for chemotherapy, or an implanted port for repeated infusions. Understanding how these devices work and how to care for them can make a huge difference in patient outcomes.